Hello, and welcome to Murray Regional. If you're seeing me, cases are that you or a loved one have been diagnosed with sepsis and was given a booklet like this. Over the next few minutes, members of our team will help you have a better understanding of what sepsis is and what to expect during this admission and when you go home.
What is sepsis? Sepsis is the body's toxic response to an infection. Sepsis is a medical emergency. Sepsis kills almost 270,000 Americans each year. Every hour that treatment is delayed, the mortality rate increases by 8%. Survivors of sepsis are 3 times more likely to develop a cognitive impairment. Many sepsis survivors also have to live with lifelong deficits, such as amputations or post-traumatic stress disorder. There's no simple cure for sepsis, but sepsis can be prevented by treating infections that can lead to sepsis. Some symptoms of sepsis goes along with the word sepsis, S-E-P-S-I-S. So the first S in sepsis is shivering, fever or cold. E is it for extreme pain or general discomfort. P is pale or discolored skin. The second S is sleepy, difficult to arouse, or confusion. The I is I feel like I might die. And the last S is shortness of breath. When it comes to sepsis, just remember it's all about time. Temperature, infection, mental decline, and extremely ill. Just remember, there is no single sign or symptom of sepsis. It's a combination of symptoms, so know your symptoms.
We'll go over some risk factors for sepsis and those who will be at risk for developing sepsis. So the first category would be elderly adults. Infants and younger children can also be at risk for developing sepsis. Anyone who has a chronic illness such as diabetes, hypertension, kidney disease, liver disease, they will also be at risk for developing sepsis. Those who have had recent surgery or dental work or in the hospital also are at risk for it. And if you are immunosuppressed, so if you have cancer or HIV, or if you're taking immunosuppressants for a certain disease that you have, you will also be at risk for developing sepsis. Those who are hospitalized or anyone who is living in close quarters, like in a nursing home or something like that, you will also be at risk for developing sepsis. Some things we can do to prevent sepsis, which would be number 1, wash your hands. If you're out in public and you catch a door handle or open a door for somebody, just remember to sanitize your hands, or if there is a hand washing station by, remember to wash your hands after that, and try not to touch your face or keep your hands out of your eyes, your mouth, stuff like that. So that will help prevent you developing sepsis. Also, get your recommended vaccines, your flu shot, your Tdap, all those things. Make sure you're up to date on those. And then if you have any wounds or open cuts, make sure they're covered and clean until they're totally healed, and that will decrease your risk of developing sepsis.
If you're prescribed antibiotics, you want to make sure and take those as prescribed. Make sure and follow the instructions. Take them until you completely run out. Some medications actually need to be refrigerated, so pay attention to that. Some are room temperature. Things you never want to do is borrow someone else's antibiotics, because different bacteria is susceptible to different types of antibiotics. So that's really important. Another type of bacteria may not affect it at all with the wrong antibiotics. As far as viral and fungal infections, those are going to be separate medications, but you want to follow the instructions on those as well. Oftentimes after sepsis, people can develop what we call post-sepsis syndrome, and it's where you have some fatigue, difficulty sleeping, muscle soreness. Some people even have a little bit of PTSD after leaving the hospital. Typically, if you're in critical care, it increases your likelihood of having those symptoms. You just want to take it one day at a time, try to rest, relax. If you're having any symptoms that you can't control, you want to maybe talk to your family or talk to your doctor. You want to rest and rebuild your strength as often as possible. Do what you can without overdoing it. If all you can do is walk to the bathroom and back, then just do that. And as you can do more and more, you can build on those types of things. Get plenty of rest, though. That's going to be really important. And again, just make sure you're getting plenty of fuel for your body. Eat a nice balanced diet. That's going to be really what you need in order to help you get better and get back to your baseline.
Many sepsis survivors are left not only with physical challenge, but mental and emotional as well. In the United States, more than 1.4 million people survive sepsis each year. If you have more questions about sepsis, ask your nurse or go to these websites.